What is nasopharyngeal and oropharyngeal suctioning? It's performed to remove accumulated saliva, pulmonary secretions, blood vomitus, and other foreign material from these areas that cannot be removed by the patient's spontaneous cough or other less invasive procedures. These are the following materials: suction machine, suction catheter, sterilized gloves, sterilized water, large towel, tongue depressor if you have, and a face mask. First is we need to check for the doctor's written order for suctioning. Assess client's respiratory status, respiratory character, and the breath sounds. Assess for chest sounds and audible secretion during respiration. This is to know for signs and symptoms if the patient have a difficulty in breathing. Perform hand hygiene to prevent transmission of microorganisms and to prevent possible infection. Make sure to organize all needed materials for us to do an easy procedure. Identify the client and explain the procedure to the client so that the patient will not be scared and to have his or her full cooperation during this procedure. Lower side rails and position the client in a semi-Fowler's position if conscious. If unconscious, on side lying position towards you. Semi-Fowler's position to prevent aspiration. Make sure to place a clean towel or drape on client's chin. Set up the sterilized container and open the sterilized solution. The purpose of sterilized solution is to flush catheter after each suctioning. Put on sterile gloves. Reserve the sterile glove on your dominant hand for contact with the suction catheter and use the non-dominant hand with the tubing. Set the pressure on the suction gauge. Turn on the suction and place the thumb over the end of suctioning tubing. Adjust the suction to the appropriate pressure. Adults and adolescents no more than 150 millimeters of mercury. Apply lubricant to the first 2 to 3 inches of the catheter using the lubricant that was placed on the sterile field. Insert the catheter. Be sure the finger is not covering the suction port through the mouth using a tongue depressor. If necessary, hold the tongue for visibility. Slide the catheter along the side of the mouth to the oropharynx until the client cough or resistance is felt. Be sure finger is not covering the suction port. Holding thumb over the opening in the catheter, apply suction for 5 to 10 seconds, maximum 15 seconds. Suction only on withdrawal and do not suction for more than 10 to 15 seconds at a time to minimize tissue trauma. Replace the oxygen delivery device using your non-dominant hand if appropriate and have the patient take several deep breaths. Withdraw catheter slowly while applying suction and rotating catheter between fingers. Place tip of suction catheter in a sterile water and apply suction for 1 to 2 seconds. Encourage the patient to breathe deeply and to gap between suction, allowing 20 to 30 seconds interval between each suction. Never apply suction more than 3 times. Limit suction to 5 minutes in total. Turn off suction source using non-dominant hand to listen to patient's breath sound and assess per patient need for repeat suctioning. Disconnect suction catheter from suction tubing. When suctioning is completed, remove gloves from the dominant hand over the coiled catheter, pulling them off inside out. Remove the glove from the non-dominant hand and dispose of gloves, catheter, and the container with the solution in the appropriate receptacle. Assist the patient to a comfortable position. Raise the bed rail and place the bed in the lowest position. Perform oral hygiene on the patient after suctioning. Provide oral and nasal care to assess the patient's respiratory status, including respiratory rate, effort, oxygen saturation, and lung sounds. Discard used equipment appropriately and throw it in a proper trash bin to prevent contamination. Wash your hands again to prevent transmission of microorganisms. Record the procedure. Evaluate client character of respiration after suctioning, tolerance of the procedure, color, amount, and consistency of secretions, then record and document it.